Dear colleagues and friends, I would like to share with you a specific case example, one of many that we have included into the trial. It's a 70 years old gentleman with ischemic cardiomyopathy, with multiple vessel disease, dyslipidemia and arterial hypertension, smoker, with a history of percutaneous coronary intervention. Unfortunately, he is still in New York Heart Association class of angina third. On the optimal guidelines-based medical therapy, namely diuretic, beta blocker, ARNI, and spironolactone. Of course, he is taking antiplatelets, clopidogrel, and aspirin because of the history of percutaneous intervention, and he is on rosuvastatin because of his hyperlipidemia. As you can see, his ejection fraction, despite the percutaneous intervention and the guideline-based therapy, taking more than 6 months in stable situation, his ejection fraction is only 26%, and the quality of life questionnaire score is 46 points. On the next slide, you are going to see, in fact, the investigation on the baseline before the treatment with Amendcor. You see the globulous left ventricle, the enlarged left atrium, and these measurements of his ejection fraction in systole and diastole, with both systolic and diastolic dimensions increased. On the next slide is, in fact, the evolution of the ejection fraction and quality of life. In fact, gradually during the time, thanks only mentioning again the only difference in the treatment with the Amendcor supplementation after 6 months having guidelines-based therapy, and he was among the so-called hyper responders. You see that during the time his ejection fraction of the left ventricle increased to 33%, and in several months to 47%, and the quality of life score increased to 119 points. On the next slide, you are going to observe, in fact, the visualization of what I'm mentioning. So the disappearance of the globulous state of the left ventricle, and you see the reduction both of the systolic and diastolic dimensions of the left ventricle, and decrease of the dimension of the left atrium. This is one of the really very impressive cases with the result of Amendcor as a crucial supplementation in patients with heart failure. Thank you very much for your attention.